Hey there, and welcome to Get Career Curious, the podcast that gives you the inside scoop on careers, what it takes to get there, and what the job is really like. This week, we're talking with Claire Cunningham. Claire is the CEO of One World Surgery, a global nonprofit that provides life-changing surgical and primary care to patients in underserved communities. Under her leadership, One World Surgery now operates in 2 countries, supports over 27,000 patients, and coordinates 2,000 volunteers a year. But Claire doesn't just run things from the corner office. She's lived it. She's worked in over 30 low-resource countries, and for 4 years, she moved her family to the Dominican Republic to help build a world-class surgery center, literally from the ground up. Whether you're figuring out your next step or dreaming big about global change, Claire's story is proof that doing good and doing it big can go hand in hand. Let's get career curious with Claire. Hi, Claire.
Hi, Marita. How are you?
I'm great. Thank you for being on the podcast today. So let's start at the beginning. What inspired you to pursue a career in global health and nonprofit leadership?
Well, it started really, I would say, from my parents. And my dad's an emergency room physician. My mom's a nurse. And just, growing up and watching how they dedicated their life to service. And I sort of always had that in the back of my head. But it wasn't until my senior year in college where I got to spend a month in Botswana, Africa, and really just saw the landscape and was first introduced to global health. And from there, that sort of set me off on the trajectory of dedicating my career and really my vocation to the field of global health and the intersect of nonprofit.
So your first trip to Africa, tell us a little bit about that and how that fired you.
Yeah, absolutely. So I did in my undergrad, I took a handful of courses in African studies and then was able to have sort of a qualitative research project through DePaul University as a winter term. And so I spent winter term in Botswana. And at the time, it was the highest rate of HIV in the world. So there was a lot of truck drivers that would come through the country because it was a mining industry, and really just was introduced to the disparity and the impact of what it's like to have such a range of public health concerns, but not having the resources to meet that. And so that experience then introduced me to the opportunity of volunteering. And so after I graduated from undergrad, I then worked at a children's home in Kenya and Ghana. And both of those experiences just further validated how passionate I was to just the inequities in the global health space. Like there were kids in both children's home should be alive today, but they're not because they didn't have adequate resources. It was a wonderful organization, but they literally didn't have the money to provide the kids with healthcare that they needed or even feed the kids. And so just recognizing the privileged place I came from and then was introduced to the nonprofit space, it sort of just started me off on this journey.
And so when you came back from Africa and you started your first job, where did you start and what did you do?
Yeah, well, actually, one of my first jobs was actually in college. I sold knives. My brothers used to tease me about this, right? I sold Cutco knives and I was like a top Midwest sales rep. But I'd come home with these trophies and my brothers were like, oh, really? So great. Sell the knives. That got me excited about sales. So I was thinking, okay, maybe I could work for like a pharmaceutical company because I hadn't heard about the fundraising space. And then when I was just doing networking at a young age, right out of college, this woman said, why would you go work for a pharmaceutical company to hopefully get into their community relations program? Like really what you're passionate about is social justice efforts, which is really more the nonprofit space. And if you like sales, you should think about fundraising, which is essentially just selling a cause you're passionate about. So my first job, though, was I worked at CPK, California Pizza Kitchen, and I wore a tie. And I just kept networking until I was introduced to this nonprofit that does incredible work in the global health space. and started off fundraising. I did like events. My first job was a golf tournament. And it just kind of built on from there and just really loved the nonprofit fundraising development space.
What do you love about it? I mean, and what kind of skills do you think someone needs to be successful in fundraising?
So, like you, I played a collegiate sport, but nowhere near the level or competitiveness. I mean, I like rode the pine, college basketball D3 for a short period of time. But I share that because being an athlete, I love, I'm very goal oriented, very competitive. And so that just for me translated to with fundraising, it's sales. You either hit your numbers or you don't. And so I like that piece of it. And I really am motivated by, for me, this sector, the global health sector, but being able to give people the gift, whether it's individual, companies, governments, the opportunity to really make a transformational change. And so the skills that it takes is you have to be hardworking, you have to be willing to get a lot of no's before you get to a yes, strong relationship building. And a lot of it is being passionate about what you're advocating for.
That's very true. And you're very passionate about global health. Your whole career has been focused on this area. So you went from a more or less fundraising or development to what was your next progression in your career?
So I had been with one organization for 10 years, and sort of every 3 years, I took on a different set of challenges and sort of grew in my scope of responsibility and leadership and management, but wore a lot of different hats within that space. It evolved from more of event sales to then corporate fundraising to then I stepped into an executive director role. But really, like when I think about my career progression, it was really about seeing opportunity and how I believed I could help fill that gap. It wasn't for me so much of let me take on the next title. It was more of like, let me take on the next challenge, seeing an unmet need, and that kind of can fit on a lot of different, everything from like globally as it's viewed for now working in the global surgery space to just from an organizational perspective, there was an opportunity and wanting to kind of lean into that. So our family moved to Chicago and my husband was doing his residency. And it was during that period where I visited the surgery center in Honduras. I mean, this was almost 10 years ago and was introduced to the global surgery space. And this organization, which is where I took my next career change and stepped into a role. And at that time, it was the executive director of the organization I'm with now, One World Surgery. But truly, Marita, it was like, I had no idea exactly what I was stepping into. I mean, at this time, there were 2 different nonprofits. There was no governance structure. They didn't know how many employees they had, how much money in the bank account. So for me, again, it was really about what motivated me to see an opportunity of how I think I could have moved the needle and made it a little bit better.
Yeah, and that's something I wanted to dig into a little bit is that most people have the perception that if I want to make an impact in global health, I have to be a doctor or practicing healthcare provider in some capacity. Yet there are a lot of opportunities out there that aren't necessarily medical field related. And you and your team are making tremendous impact. What are some roles in global health that people could seek if they're interested in making an impact here?
Yeah, great question. And it's something that I hear all the time. We host about 2,000 volunteers between our 2 sites, and a lot of them are, young adults interested in trying to find their way in the global health space. And so I think, one, there's an opportunity with program development or project management. So really not needing the background, like a clinical or medical background, but if you're really motivated by developing programs to help address some of the global health challenges, that's one career option. The second is, like I said, fundraising, nonprofit. And then the third is, oftentimes it's just as in for-profit, sort of the support services that are needed to run an organization. So whether it's HR, finance, anything within the administration, accounting. I mean, these are all things as a global nonprofit we need, and we can't run our organization without those key functions. It just is a matter of when we interview people is not only do they have the skills, but particularly for nonprofit, do you have the passion for the mission? Like, is it clearly motivate you to kind of show up and drive the work that we do every single day?
Right. So what do you say to a young person who it really wants to do good in the world, but then they're also like, I need to make money to support myself? How does it work as a career path? Are they more or less comparable to the corporate world?
Bottom line is, nonprofit by and large does not compensate in the same way that a for-profit industry does. How I view it is ultimately, there are other ways and other benefits that you're, of course, getting through working with a nonprofit, but directly you likely are taking a pay cut. That being said, there's different sizes of a nonprofit. The larger the nonprofit, oftentimes the more competitive their pay can be. What I have found for us as an organization is our ability to attract and retain top talent is we're able to view our overall compensation package as we think about we have unlimited PTO and we get a week off at Christmas and people get to work remote. And most importantly, it's mission driven. I mean, every single day. Yeah. And not to say that this doesn't happen, of course, in the for-profit space, but every single day you get to wake up knowing you're making a profound difference in the world. Yeah. And those things money can't buy. And I also like to think being a full-time working mom of 3 young kids, I'm able to walk the walk and really model that behavior. I was able to have lunch with my 2 boys at school today. I don't know if there's a lot of CEO female leaders that get to be able to make their schedule and feed their kids breakfast and have lunch with them on off days. Not every day. Absolutely do put in some long hours, but I think your work-life balance can look different, and that's a value add a nonprofit can bring to the table.
Beyond the work-life balance is you can feel really good every day about what you brought and what you've changed in the world. And speaking of that, can you just give a high-level overview of what it is your organization does and their mission and how you directly are affecting lives?
Yeah, absolutely. I love talking about this. My favorite conversation. And also it's even that much easier because I got back from Honduras on Friday and it brings tears to my eyes, like just recognizing the profound impact that we're able to make on the most vulnerable, marginalized citizens in the countries where we're working. I mean, literally this man was wheeled out of the operating room after having spent a decade of just neglected surgical traumas from within the public system. And he's walking out of our operating room and he's clapping, right after surgery, everyone's in tears. During that trip at our surgery center, we also had a urologist and we also had an OB-GYN surgeon, and they had said in their entire professional careers, they had never seen the magnitude of the suffering. I mean, the women who had come through just the first couple of days in clinic, they had needed to have a gynecological procedure because they had been bleeding for years and years and years. One woman had had a blood transfusion. I mean, you can imagine not just like the physical pain and suffering, but the impact to that person's dignity. And here they are the next day, they're having a surgery that, like in the US, it's a routine procedure and you have access to. And so literally it's life-changing surgery. And so for us as an organization, there's 5 billion people in a world of 7 billion people that have access to safe, timely, and affordable surgical care. And that's our model, is to address that directly by performing surgeries, but then also to lift up the future healthcare leaders of both countries by not only investing in our local team, but we have programs in our countries. We have the medical students and training, and we work with the range of universities at both sites. But bottom line, it's to continue to address a unmet need in the global health space in Honduras and Dominican Republic.
So having personally been to one of these locations, it's pretty inspiring. And I can see why you're so vested in it. So how had working with different cultures shaped how you manage and connect with people? Because I think that's another interesting aspect of your job is you are always working with people from different cultures.
Yeah, I love that you asked that because I feel like it's one of the greatest gifts and privileges being in this organization and being in my position because you learn so much from our global teammates. You just also recognize like what an immense blessing and privilege it is to have been born in this country and the challenges that the majority of the world face, particularly those that come from a different socioeconomic background, particularly women, if you come from a different place of sexuality. I mean, it is just so hard in this country to like wrap your head around the level of adversity that so many people face day in and day out. And so when you ask that question, for me, it's just like recognizing what an opportunity is to learn and have that exchange from our global teammates, and also to just be so grateful for the life that I have and the fact that I was born here and have just so many gifts at our disposal.
That's sweet. Claire, what is the coolest part of your job that maybe someone wouldn't know about?
One of the best parts of my job is working with and learning from brilliant leaders. Like within the nonprofit space, when you have a really great cause, you oftentimes have really impressive thought leaders of like the various industries where perhaps maybe someone with my experience wouldn't have the access to someone like that. But I've just worked with tremendous heads of state, corporate leaders, multinational government leaders, and it's given me a seat at the table that you wouldn't otherwise think being a leader for a nonprofit. And then I would say the second piece of it is just working in the international development space and global health spaces of travel and like getting to see the way the rest of the world lives, but like not from a tourist perspective, really, of an immersion into just a different life, different culture is such a gift.
So what do you say to someone who wants to make an impact on the world but doesn't have a clue where to start? Like, what advice do you have?
Right. I think it's start by listening to podcasts like these, like learning, right? And then, I mean, I speak for myself, but I have had so many wonderful people that have said yes to networking and making introductions, whether it's an internship or volunteering or just going out for a cup of coffee. And so just continuing to keep kind of an open mind and talking to people that have had the experience and life wisdom and the reps, right, of how that could connect to what their passions are about. And then, you know, continue to ask the question, like, who else do you know? Who else should I be talking to? And you just don't know how that will continue to cascade and open more doors for you to like find that career journey for you. I don't want to say dream job because, you know, it's all like a journey, like figuring that's life, right?
Yeah, and there's always twists and turns. So what do you think is the most underrated skill in your job?
I mean, just I would say like almost in life, like I'd say emotional regulation, right? I mean, it falls into, I'd say in general is EQ, like someone having a strong emotional intelligence, but then like the subsets with that is like the ability to have self-awareness and emotional regulation. That just to me is like a kind of a cornerstone of then how that impacts relationships, because in the end of the day, no matter what career you're in or what space you're in, like it comes down from my perspective to being able to build, maintain, and relate healthy relationships and like resolve conflict. But in order to do that, you have to be able to regulate your emotion, and that can be hard.
Yeah, it definitely can.
Yeah.
So as a female CEO with a family, that's a lot to juggle. And what leadership or life skills advice do you offer to young women who want to pursue a career as challenging as yours is?
Surround yourself with great people.
No.
And when I say great people, that means your family, your friends, whoever it is within your network, because it does take a village. Like I could never, ever do my job if it wasn't for my husband, for my aunts and uncles, for my parents, for my friends. And I think there's a misconception of like you have to create space between your personal life and your work life. It's just there's such blur and it all is so intertwined, particularly with the remote work environment we have now. And so being able to show up how you are day in and day out means like you also have to bring the good and the bad and the life to it, and just being able to speak your truth. And a big part of that is having a support system that will help kind of stand you out through the highs and lows of it. So continue to stay close with your friends and family.
Super advice. All right. So one closing piece of advice that you'd like to give to a young person who maybe has never really considered a career in nonprofit, what should they know about nonprofit?
I would say in my, 20 plus years working in the nonprofit space and having spent a lot of time with people in this space, if you find a cause you're passionate about, you'll never look back because you're going to spend the majority of your waking hours at work if you choose to continue to have a full-time job, right? 40 hours a week. And how could you not wake up every day, go into work if you weren't super passionate about it and committed to really making a difference? You have this one life, right? And to know if you have the opportunity to use your skills and your talents and your time to pay it forward, why would you not do that? Yes, there's always trade-offs, but in the end of the day, I am such an advocate for working with the nonprofit space. If any of your listeners want to network, they can reach out to me. Happy to share more about it.
Hey, thank you. That's great advice. And I so appreciate you getting on this podcast and sharing your wisdom. And honestly, I can't wait to watch how your career continues to grow. Thank you for joining us today. Our goal is to help listeners discover meaningful careers that bring them joy and purpose. If you have a friend who might benefit from today's discussion with Claire, please share this episode with them. Want even more career insights? Join our community at getcareercurious.com. Subscribe for exclusive content and behind-the-scenes access of this podcast that you won't find anywhere else. Thank you again for joining me, Marita McCahill, in this episode of Get Career Curious. I'll see you next time.